We're going to talk now about individual and group interventions that you will be learning how to do and practicing when we meet in person. And these are specific to critical incident response that you'll have as a peer support member. So what you're essentially going to be doing overall is providing support in order to normalize reactions that are occurring because of abnormal events. So any way that somebody reacts to uh, any work scenario that's distressing is a normal reaction. It's the event that was abnormal. So big picture, that's what you're doing as a peer support member. So the most critical skill you'll use is your ability to listen with the purpose of understanding. So listen to understand, not to think about what to say next or to analyze, uh, anything else going on around you, but purely to make sure that you understand the person. So you all have active listening skills that you use all the time and have already been trained in and practiced and everything else. We will go a little more in depth into those individual one-on-one skills and then even an outline for how to provide a one-on-one individual sort of diffusing for somebody after an incident. And then we'll also talk about group supports. So we'll talk about diffusings and then also debriefings. And we'll have a member of a CISM team come and present, and then we will be practicing. So generally, I won't go into this in a deep way now, but the supportive communication you'll provide in your peer support role breaks down to these specifics. So this is just a bullet point list at this point, but we will go into these further when we meet in person. So active listening is your verbal and especially your nonverbal skills. And the goal there is listening to understand. You're going to use empathy and compassion as tools as well, because those help a person calm their system. You can help create oxytocin. When someone feels understood by you, they will have a rush of oxytocin, which counteracts adrenaline and helps calm their system, and they can become more amenable to you, more cooperative, and builds trust. You're going to use the principle of neutrality. So you don't need to take a position on things, and you really shouldn't in most cases when somebody is experiencing some sort of dilemma. And so your neutral position actually provides them with the healthiest support where they can come to whatever might be the best decision or way to proceed for them. You're going to be using problem assessment. And so you will get a sense of what the person you're speaking to thinks their problem is, and you may have a different sense of what their problem is, or you may agree. And so having the information and tools that you'll have from this training will allow you to have a strong sense of what's going on. And you already have a lot of the skills and strategies you need for that in all of your people reading and behavior reading abilities that you have. And then goal setting is another one. We'll talk about this. So the bottom line here is that you always want to be working towards something when you're providing support. And it's really important to know what that thing is. So this is not necessarily a, very structured verbal kind of rule or strategy that needs to be followed. It's more so like generally you need to know where you're going for this person. And most importantly, where would they like to be? So if you don't know where you're going, it's going to be hard to get there is the idea. So this is important in therapy sessions as well. We need to know what we're making progress towards so that we know how to get there. And if for some reason we aren't making progress, we need to problem solve that. In your role, one of the reasons someone may not be making progress is because they need a higher level of care, professional support in one area or another. That's usually what's happening there if they aren't making progress. We'll be talking a lot more about proportionate responses. So this has to do with problem assessment. And as you're gathering information in your conversations and as you're building understanding, you're going to be assessing what all is going on. And then that's going to help make sure that you provide proportionate responses. So this would mean if there are indicators for a substance abuse problem or for suicidal ideation, that you're recognizing these things and then responding appropriately and proportionally. So the risk to under responding is greater than over responding, but hopefully you won't do either because best case, your team has access to a clinical consultant and you should always be able to run these scenarios by them and double check what it is you're thinking. Your basic crisis communication techniques are of course important. You have so much of this already from the work that you do in your roles as a first responder. And so we'll be just reviewing these and building on them and practicing them. And then case examples. So we'll talk through examples of what scenarios are likely to come up, general ones that apply to lots of people as first responders, and then how to navigate those. So we'll first talk about what is a debrief, and then we'll talk about what a diffusing is, because these two need to be understood as separate group interventions. And the main difference to be aware of right away is that you will be able to lead a diffusing by the time you finish this training. As a trained peer support member, you'll be able to run diffusings or facilitate them. And then debriefs are a little bit different and really should be run by either a formally trained CISM member or a licensed mental health professional who has experience in that area. So a debrief is a group support intervention. It's got 7 phases to it, and these are held after distressing events. So the goal with a debrief is to mitigate the stress impact of the event and to help facilitate the recovery process. So debriefs and diffusings as they stand alone are not an appropriate approach to mental health for a public safety agency, but should just be a portion of a broader approach. So them alone are not enough. These have been around for a long time, and they certainly are certainly can be a positive for a lot of people, but they aren't sufficient on their own. So luckily, lots of mental health programming is picking up and increasing, certainly here in Minnesota, so that's a good thing. So debriefs are a form of psychological first aid, quote unquote first aid, and they're not an alternative to professional mental health care. So this is my recommendation. I don't recommend that anybody be mandated to attend a group debriefing. It certainly helps if everyone who was directly involved is there, because that process of who was there first and kind of putting all those pieces together, who arrived next, how did the call come in, some debriefs are inclusive of everybody from dispatch through police, fire, EMS, all the way to the emergency room doctors. I've seen at a debrief. So it can be that thorough in how comprehensive they are and who is all invited. Not all the time. but sometimes, and sometimes that's a huge help to put all the pieces together. The reason that I never mandate that everybody attend is that in the clinical world, it's not recommended to have individuals attend group sessions who haven't first done their own individual trauma work. So if someone is experiencing post-traumatic stress, it isn't necessarily good for them to attend a group type intervention, and it may actually be what they need, and what would be best is an individual care with a mental health professional. So I always start debriefs by mentioning nobody is required to be here and nobody is required to talk. And so if you were told you had to be here, or you changed your mind and you don't want to be, you're more than welcome, and please do just excuse yourself, because it's better than being in this scenario and getting more information than is healthy for you about a distressing event. So anybody who doesn't attend a group intervention because they are worried they'll feel worse because of it really should be accessing individual. So a debrief tends to last about an hour. I've certainly facilitated some that took close to 2 hours or more, just based on the incident and the size of the group. It can get to be a lot though. If it goes over about 90 minutes, that's a lot. So having them be about an hour is usually best and common. So that's a little bit about a debriefing. A diffusing, on the other hand, is shorter and it's a less formal version of a debrief. And it's usually a smaller group. They are closer to 15, even sometimes 10 minutes, up to about 30 minutes in length. And then you as a peer support member, and potentially another member along with you, especially if it's a larger diffusing, are going to be trained and then can facilitate these. These are best conducted before the end of the shift that the event occurred on. So certainly before the first sleep cycle is the idea. And what the neat thing is about a diffusing is sometimes when you can triage the acute stress phase, plug in this type of support, help people recognize how they're feeling and what to expect and how to manage what's ahead, sometimes a debrief just isn't necessary if you've done a diffusing and it's done well. So having these conducted before the end of the shift has some logistical challenges, of course, especially for smaller agencies with fewer peer support members and multiple shifts to try to cover. But it's such a neat resource and tool that you have. And I highly recommend using these. So we'll talk much more about these in person. The afternoon of the second day is really when we focus on these. You will have all your questions answered. You'll practice these. You'll see them run. You'll be part of a scenario of one. And so I imagine you'll get really comfortable with them. These are also, I want to say, really already being done. They just happen very informally at most places, maybe not with the type of structure and educational kind of information piece that normalizes how everybody's feeling and what to expect and what to do. But that is really the meat of it that's added to the way that you all already process what you experience with each other. So it's shored up a little bit, more formal, more structured. This ensures that it goes well. And then a lot of times the really powerful thing about it is that the event happened so recently that it's still fresh in the nervous system for the people who are having the diffusing. So if you were part of an incident, you can't run a diffusing or help run a debrief. You really need to be a participant, not a facilitator. So that's something to keep in mind. I want to just touch big picture on group dynamics here because groups are so neat. I took a class in my master's course about group work, group therapy, and a debrief and a diffusing. They are not therapy. They're specifically not clinical and not therapy. But there's still those group dynamics at play. So there should be always at least one facilitator, if not more. And the idea is to be able to, between the two of you, have, or more, sometimes four, for a larger group. The idea is to have eyes on the whole group. It's a calm conversational approach in both realms, the diffusing and the debrief. And it can just be helpful to hear how others are doing. It helps normalize however anyone is doing, to hear how everyone is doing, and then to put the pieces together. So it helps facilitate understanding, it educates and informs so that attendees can cope with the stress. And then everybody gets to learn from what everyone else says. So that's kind of how that group dynamic is so valuable. The rules are that they're confidential, so nothing leaves the room. Nothing gets written down or documented. It's not a critique. It's not the time to talk about what you think someone did wrong or any of that kind of between attendees. It's non-judgmental. It's not about the tactics or the operational aspects of a scenario, and nobody is required to. So when we meet in person, you will have a chance to cover both individual and group interventions in more detail. It's nice to be able to give you this intro here so you can start to formulate your understanding of it. You may have experienced diffusings and or debriefs already. You may have experienced peers supporting you one-on-one already. That's wonderful if you have. If you haven't, don't worry. We will get you all set up to jump into this right away when you're done with the training. And then we'll also give you handouts with steps for both a diffusing. So you'll have the steps in front of you and in hand as you facilitate a diffusing. I still have them. I carry them around with me for any time I'm going to go assist with one of these. And so it's definitely important to just keep those on hand. You can also turn them into kind of a card-sized guide that you can keep in your wallet or in the pocket of your uniform. So the goal with these and our training is that you leave feeling confident about running diffusings at your agency. I wanted to just mention here any other training topics you might be interested in. You've already, as part of this training, seen the law enforcement couples presentation. And so that's also an option on our website. And then preparing for and coping with an officer involved shooting is a training that's available on our website. Therapy dogs for public safety agencies is one, which was really fun to do. And I love seeing all the agencies that are picking up on this idea of having therapy dogs on site. And then we have a 4-hour training on the 6 resilience factors, which you will get really the meat of that when we meet in person. And then there's a training for law enforcement therapists in there, and it's this Power Part 1 training. We have wellness for corrections staff, wellness for public safety administrators, as far as what an agency can be doing and what we hear most from all of the agencies we work with around the state on what helps and really promotes a culture of wellness within an agency. And then the healthy or the law enforcement couples training that I mentioned earlier. There's a few recommended reading options here. Of course, Kevin Gilmartin for any first responder, that book applies, Emotional Survival. For any significant other of a first responder, I Love a Cop is a great book by Dr. Ellen Kirschman. The Body Keeps the Score is a great starting place if you want to learn more about trauma. What Doesn't Kill Us is an excellent read about resiliency. 7.5 Lessons About the Brain is another really good book to understand trauma and brain science. The 5 Love Languages, 7 Principles for Making Marriage Work. There's a lot of options here. So the podcasts that are my go-tos are the Huberman Lab podcast. He's a neuroscientist with Stanford. And then Michael Gervais has Finding Mastery. He's a sports and performance psychologist. And then Squad Room is a neat one. He is a sergeant, I believe, in California, and he shares a lot of neat insights. So thank you for listening, and I look forward to the next time we chat.